Can we go to roll call?
Mayor Nickel, Deputy Mayor Gerton, Councilmember Nutt, Councilmember Romy,
Here.
Councilmember Dyer. Also in attendance, City Manager Coffey and City Attorney Bone.
Here. Mayor Nickel.
I'd like to make a motion to excuse Mayor Nickel.
Second.
Okay. So on we go.
Need to vote on it.
We'll go 3-1, 3-0, 4-0.
We gotta ask for a vote.
You,
Okay.
That was self-explanatory. Yeah, I understand. Additions, deletions, or changes to the agenda, if any?
none.
No additions, deletions?
None.
Okay, move on to presentations, proclamations, and introductions. Let's go to our fire department, Chief Lewis, and his presentation for fire department promotion.
Thank you, Deputy Mayor Gerton. Today's a very special day for the Indian Harbor Beach Fire Department. We're here to celebrate the accomplishment of firefighter Russell Hoover, whose completion of the Eastern Florida Fire Academy and his certification as a firefighter 2 by the State of Florida Bureau of Fire Standards and Training. Russ, have your family come on up. I'd like to take this moment to tell you a little bit about Russell Hoover. Russ grew up in Sacramento, California, and joined the U.S. Navy in 1991. Russ proudly served his country working in repair and damage control for 26 years before retiring with full honors in 2017 as a senior petty chief officer. Russ and his wife Cindy, a retired Navy commander, moved to Palm Bay in 2019. Together they enjoy 6 children, 4 girls and 2 boys, ranging in age from 22 to 36. In 2023, Russ found the Indian Harbor Beach Fire Department and seized the opportunity to become a volunteer firefighter. In Russ's words, he loved volunteer firefighting so much that he longed to do more of it. So at the young age of 53, he joined the Eastern Florida State College Fire Academy. 492 mentally and physically grueling hours later, Russ became the newest certified firefighter here at Indian Harbor Beach. Just before starting the Fire Academy, Russ completed 300 hours of emergency medical technician training and became nationally certified as an EMT. With the academy now behind him, Russ has set his goal on becoming a paramedic, one which I'm sure he is easily going to accomplish, having worked beside Russ caring for patients here in our community. We have 3 cherished items to present to Russ this evening. First, we have the pinning of the firefighter badge. And for that, I'm going to be assisted by a While she's doing that, I'm going to tell you a little bit about firefighter badges. Firefighter badges are a powerful symbol of courage, dedication, and enduring commitment to public safety. The tradition of firefighter badges began with volunteer fire companies back in the early 19th century. Badges, or shields as they were known, were used as a way to identify authorized firefighters who stood between danger and safety as a way of preventing looting of burning buildings, a common problem of the 1800s. Next, we have the presentation of the fire helmet. Very much earned it. The fire helmet's an iconic symbol of the modern day fire service. It serves as an integral component of our protective ensemble, protecting the firefighters' heads against falling debris, projectiles, and thermal injury. It's also a symbol of rank and a sign of respect to the firefighters who come before us. Jacobius Turk is credited with inventing the first fire helmet in the 1730s in New York. The helmet was handcrafted leather with a high crown and a wide brim, much like you see here today. The modern fire helmet is credited to Henry Grodekop around 100 years later. The high crown deflects falling objects, while the wide brim directs ashes and water down the firefighter's back, away from his neck and off his coat. The crest, or the front piece, shows the firefighter's rank, the department they work for, and usually their station. The metal eagle that holds that crest represents pride, courage, and valor. The colors of our fire helmets are an outward sign of rank and position the firefighters hold within the department. Blue is for support firefighters and students, firefighters who are learning and still achieving their certifications and are not permitted to enter a burning building or an environment that we consider immediately dangerous to life and health, or IDLH. Black helmets are for certified firefighters, like we see here today. These are the workhorses of the fire department. These are the ones who run inside the burning buildings and put the fire out. Red are for company officers, those that supervise the fire engines and the fire trucks, the company of firemen that are on those apparatus. And finally, the white helmets are for chief officers. Those are our command staff, who are responsible for the overall incident objectives and crew assignments. With that, we present this black helmet to firefighter Russell Hoover today, our newest certified firefighter. To call firefighter Hoover a workhorse is an understatement. We all admire his countless hours that he spent physically training and improving himself for this endeavor. It was a sight to behold. He was out there many a day. So finally, we have our city firefighter's oath of office for our non-probationary certified firefighters that will be administered by our acting city clerk, Nikki Gold.
If you go mute the mic, you have the floor for 3 minutes.
I'd also like to thank everybody in the community for the support they show us all the time as a department, not just me as an individual, but all of us. The work we do is important, but more importantly, you allowing us to do that work and supporting us while we do that work is very, very important. I hope I live up to my black hat. I'm sure I will, and I look forward to earning the next one. Thank you very much.
Thank you. That was very nice.
Look, we have presentations, proclamations, and introductions. So proclamations. We have National Suicide Prevention Month. Anybody from represent? Okay, National Suicide. Okay, let me go ahead and read it, and then you take care of it. Whereas September is designated as National Suicide Prevention Month as recognized by the National Association of Mental Illness, and whereas many health officials, community leaders, locally, state, and nationally understand that mental illness is a significant issue of concern, particularly among our youth, and whereas it is realized that to address mental health issues requires more open and honest discussions about mental health, and whereas one major hurdle is removing the stigma attached to mental health treatment and discussion, and whereas individuals, businesses, organizations, public officials, and many others recognize the importance of emotional health, now therefore be it resolved that the Indian Harbor Beach City Council support efforts on the Space Coast to provide education and resources for mental health problems. Be it further resolved that the Indian Harbor Beach City Council will encourage a positive effort to encourage those with mental health issues to seek the help of the family member, friend, colleague, and or licensed mental health professional to assist them in times of need. Witness our hands and the seal of the City of Indian Harbor Beach this 26th day of August 2025. What did we do for Scott's signature? I want to bring it down.
I'm Wayne Price, and I'm with the Space Coast Health Foundation. This is the 4th year we've done this initiative. At Indian Harbor Beach, you've been an early supporter of this, and we appreciate your support and your leadership on this issue. So thank you very much.
Thank you for support. Proclamation number 2. Do we have anybody representing Kids Day America? Okay, since nobody's here representing it, I'll go ahead and pass this on. Okay.
Real quick, I'm sure if you guys are more than welcome to stay, but you guys don't have to if you're from the fire department. So this is the not fun stuff.
That was very nice, Chief. That was very nice. Let's move on with the city manager's report.
Yes, Mr. Deputy Mayor, City Council members, residents here and watching at home. Following the not fun part is a tough act to follow, but I will make that attempt. First action item, e-bike workshop was requested at the last council meeting. I've provided some sample dates and times. Mayor Nickel, who can't be here tonight, asked me to relay to you that his preference would be one of the council meeting dates, like Monday, September 8th, Wednesday, September 24th, October 14th, or October 28th. Staff requests the council set a date and time.
I'm good for doing on council meeting days, and I would prefer to do it as sooner than later, as far as dates.
I'm actually going to be out of town, and I'll be calling in for the next council meeting, so I'm going to say not the September 8th.
So September 24th, was that work?
Yeah, I'm good for the 24th.
I'm good for the 24th.
September 24th.
Well, the 24th is not a council.
Yes, it is. It's, they moved it.
Oh, okay,
Yep.
They moved it from Tuesday for the budget
okay,
to Wednesday.
okay, I'm fine.
Yes, sir.
So we have the 24th for all four of us? Okay, 24th is then.
Let me just, the 24th is a regularly scheduled meeting date for Grant Valcaria, which I am the town attorney for. They generally don't hold that second meeting of the month. So, you know, I don't know what their plans is, but generally they don't hold it. So I can just letting you know ahead of time. It
But
could
Carl, I think we need you there, so maybe we pick another night.
Yeah.
Well, I gotta check. No, I understand that. I just gotta check with them. So I don't wanna commit.
Yeah, but I mean, we could pick another night.
Well,
just to,
or yeah,
Consensus that if he's able to, if he's not able to do
Or what
the
time?
24th, that we can go to the October 14th.
we have the 14th or the 28th.
Carl, what time do they have their meetings?
Their meetings start at, I think they start theirs at 6.
Okay, yeah, so that'd be,
How about the 24th?
Keep it on the 24th. You know, and if something happens, I'll let you know. But generally, they don't have the second meeting, but because it's budget time, that could be the only reason why they would hold that meeting. And normally I do not attend budget meetings because I've got nothing to say during it. So, let's keep it on the 24th. I'll make note of it, but I just want to let you all know that could be a conflict.
Okay, so, consensus is Tuesday, October 24th, right now.
September.
I mean,
24th.
September 20,
Wednesday, September 24th.
That's right here, I'm sorry. I overlooked it too.
5:30 or 6 o'clock,
overlooked.
It's gonna be a long one.
5:30.
5:30 is good for me.
The only one is Scott.
All right, next item, a representative of Florida Department of Transportation is requesting the city waive parking fees for non-residents the morning of September 12th at Bicentennial Beach Park, so visually impaired persons and other guests can park there and walk to the accessible pedestrian signage ribbon cutting ceremony at the intersection of Pine Tree and A1A. Staff request direction if you would want to waive that. My thought is the event starts at 10 o'clock. We would, if you wanted to waive it, we would instruct our parking contractor not to do enforcement from 9 a.m. to noon.
Any comments on that?
I think that sounds fair. 9 to 10. I was reading all about the event. It sounds really nice.
I agree. Is there a consensus or we vote?
Actually, I don't really, I think it's a slippery slope when you start, granting exemptions, and then it's hard to verify who gets to park there and who doesn't get to park there. And then once you start doing it for one request, then it's, birthdays. I think it's a slippery slope. And there already is adequate parking at that same location right there. So I would personally be opposed to it.
I initially felt like you did, Adam, for some reason. But then looking at the case, we have a blind person, FDOT involved in it, and it's all happening right there. And so in this special, it's special as far as I'm concerned. I agree with you, Adam. In a special situation here, we got the blind, there's probably only 3-4 of those in the state. Is that right, Todd? There's 3 or 4 of those type of lights in the state. So DOT is really going out and doing something special for us. And I think in this situation, I would be in favor of moving it back to what, 11? What'd you say, John? What time?
Starts at 10 o'clock. My recommendation would be 9 to noon.
9 to noon? I would go along with that.
3 hours of waiting. That's it, of parking.
And I definitely applaud FDOT for setting this up, and I'm glad that we are chosen to have that presentation here, and I think it's a very good thing as well. But just like I said previously, I think that it's a slippery slope, and once you start doing it, then you have to, if you did it for one, then you have to grant exception for the other, and then, like I said, you don't know who's parking, who's not parking, but that's just my vote, and that's why it's a panel, so I guess we'll put it up for a vote.
Okay, so we amicably went with a consensus, and, we're gonna go with the, waive parking.
Okay. Some information items real quick. The Yuma Osceola Sidewalk Capacity Improvement Projects will start, the Yuma project will start first. Staff had a pre-construction meeting last week. The Yuma project is scheduled to start on the week of September 8th at the northern end of Yuma. Staff has worked on a detouring, management of traffic, and Chief Butler will have increased presence. This map, along with information, was sent to the school and placed on social media for concerned folks to understand. The one-way traffic is to allow the safety of children and bicyclists, pedestrians who have to be in the street along with traffic. So with that, the next item, City Hall Baffle Box project update. Staff with the engineer and contractor had a pre-construction kickoff meeting last week. Notice to proceed is scheduled to be issued next week, with the project commencing later in September. Part of the overflow parking lot will be closed, and to facilitate large equipment loading, unloading, and operating, the entire overflow parking lot will be closed at times. The Algonquin Sports Complex expansion project continues unabated. Any problems? The retention pond on the southern side is largely completed, and grading continues starting on the eastern side going west. Recreation Center Bathhouse renovation project proceeding smoothly. New waste management bulk yard waste collection process update. As part of the franchise agreement, waste management will be shifting from calling for bulk yard waste pickup to weekly routes through all residential properties. This is it's hard to get all on one screen. This is the postcard front and back of what will be going to all the residents. Starting October 1, you'll no longer have to call for your yard waste bulk pickup. End of July revenue and expenditure reports as required by the city charter. The financial report is attached. Revenue with 83% of the budget year completed. Revenues are 71%, expenditures 61%. Once a reminder, grant funding projects are skewing these numbers lower than normal. Stormwater project, stormwater utility report, 97% of revenues are received and 52% expenditures are expended. That is lower because of the Baffle Box project getting ready to start. ARPA fund is at 30%, but we anticipate a sizable withdrawal pay app coming soon for that. A couple employee recognitions. Police Sergeant Wimmer, compliment. Chief Butler received a compliment via the city's online email text reporting. Very complimentary of person saying in 25 years experience he'd never met a more polite or helpful group of officers, and especially Sergeant Wimmer, who responded to a fender bender in the Publix shopping plaza. Additionally, Public Works Director Scaldo received a thank you note from the Garden Club for his entire department for their continued support of the butterfly garden that Public Works and the Garden Club installed in Gleason Park. Next meeting on September 8th, we are currently planning on a 9/11 proclamation, the first public hearing and reading for the millage rate adoption, the budget adoption, the employee pay and classification plan adoption via resolution, and a discussion of code enforcement, current code requirement issues that we believe need to be addressed, and the annual establishment of the city's legislative priorities. And if you wonder what you're going to do with the rest of your year, I've populated all the meetings and events through the Christmas holidays for your viewing pleasure. That concludes my report, Mr. Deputy.
City Attorney's report.
Thank you. Just real quick, the request for Attorney General opinion concerning the LSVs was mailed out to the Attorney General last week, so now it's just to sit and wait for them to respond. And other than that, that's all I have.
Council comments, going with Adam.
Just wanted to actually, first little cleanup item, I think we left off the approval of minutes from the August 12th.
There are no minutes.
There are no minutes?
The August 12th minutes will be on the next meeting.
Last meeting's minutes.
Copy that, okay. We recently attended the Florida League of Cities meeting, and that's a great opportunity for us to get together with other cities and learn about issues that they're going through as well, similar to us, and it's an awesome networking opportunity. They had a couple classes that we all attended the classes that went. There was a beneficial class about e-bikes and how it kind of fits into this micro-mobility world. I'm sure we'll get into it on the workshop, but learned a lot there. Second, I also just wanted to speak about the sea turtle incident. I'm sure we all have heard about it by now. I just wanted to take the opportunity to applaud and support the police department and how they handle the situation. I commend them for judging the incident on the content of the incident, not the comments of the incident, as we so far see in this present day and age. That was opportunity for education, not harsh enforcement. So I just commend the police department and the chief. We hire high caliber individuals at this police department. I know you hold them to a high standard, so we have that trust to handle those difficult situations. So good job. And that's all I have.
Hey, Susan.
So when I did my tour of the parks with Todd, lots of ideas, and one of them was regarding the large pipe on the east side of the park. And John, can you pull up that picture? We are very lucky that local artist Erin Boshart is going to donate her time and waive her fee to put our tortoises and butterflies on the pipe. She's done lots of murals at Ocean Breeze, Surfside School, 7-Eleven, Surfing Turtles. So I think this is just another way to enhance Gleason and show off how great this park is. So that's one thing. No, there's another.
Oh, no. I don't know about everybody else, but I like it.
Okay.
And I'm not an artist.
Nor am I, but I'm excited for this. The other thing is being very, I have kids at Ocean Breeze and being very attached with all the parents there. There is a lot of confusion about the construction that's going to happen, and I was wondering if Chief Butler, who I got to meet with this week, and now I understand it, if he could just take a moment, because I have a lot of parents tuning in tonight to the live stream to hear you explain. It's a little confusing. Thank you.
As City Manager Coffey said, that on September 9th, the city's going to be starting a new sidewalk project. So the project is to expand the east side of Yuma Drive. Unfortunately, I have the map here. Unfortunately, this is going to impact kids, students at Ocean Breeze Elementary School, getting to school and exiting school. So that is a huge concern of ours. We want to make sure that the kids are safe getting to and from school. It's also going to impact the pickup and drop-off lane. So we met with the contractors. I know Deputy Chief and I and Lieutenant Carter met. We tried to come up with the best plan to make sure it is the safest that we can possibly make it. So what we've decided that, at least to get the project going, that it is going to be a one-way street southbound on Yuma. So all the parents that are coming in will have to come in off Cheyenne Drive, and then pull into the drop-off and pickup line there. They will exit back onto Cheyenne, and then they can leave that way. The kids are still going to be exiting. The kids that go out that direction will still be exiting. We are putting an additional school crossing guard there, as well as SRO Imperato will also be out there to help. If we need to, we'll put a police officer out there to help. The plan is, the first part of the plan is to remove that sidewalk that's right in front of the pickup and drop-off lane from Cheyenne all the way to the first house on Yuma. That is going to take roughly 3 to 4 weeks. And then the second part of that, it's going to happen in phases. Then once that is done and it's open, the second phase will be the first 4 houses. The contractor will come in and remove the apron from each of the driveways and handle that, and then they'll move 4 houses down. What the plan is for the students is we'll have an officer or a school crossing guard there to kind of hopscotch the kids back onto the sidewalk as they move down. Once all the aprons are done on Yuma, they're going to go back up where the first house is on Yuma there, and then remove the entire sidewalk at one time. That's where it's going to be a little, to be blunt, is the extremely dangerous part, because they're going to be doing work while they're there. So what we're going to do is put cones all the way down Yuma from that point on, all the way down, and make it bike lane / walking lane for the kids to walk down. So it'll only be one lane for the cars to go down. Again, we will have extra officers out there, our school crossing guards out there for the duration. We've also, City Manager Coffey and I met with the vendor, and again, we've asked them to take a break during that time. So when the kids are exiting school, take their normal afternoon break to kind of limit the amount of work that's being done, to limit the amount of trucks that are moving and things of that nature, heavy equipment that's moving. So that's the plan. It's supposed to take roughly 120 days.
And it was supposed to be over this summer, but with,
Yes, I think
you know how that works. I mean,
think
we
City Manager-
did plan for the summer.
Correct. So it just didn't work out for it to happen during the summer.
Right.
There was some funding
Permitting
issues
too,
and
yeah.
whatnot. So it's done. When it's done, we'll have a extended sidewalk.
It'll look great.
Connectivity will be there for the kids, because that is a primary walkway for the kids. Again, we're going to do everything we can do to make it as safe as possible. I know it's extra manpower on us. We're going to be having an additional crossing guard during that period of time. But we just think it's the right thing to do, and keeping the kids. I know it's going to be inconvenient. It is for a while until everyone kind of gets the groove of it. We're putting out as much education as we can. I know you contacted the PTA for us.
Yeah,
to kind
they
of
put
get
it
that
out
there.
today.
I personally met with the principal to let them get that information out there. We're going to do everything that we can to make it as safe as we possibly can.
Thank you.
Questions?
No, it sounds like, you have the supervision taken care of when the kids are out.
Yes.
So, I applaud you.
I have a
And Susan too, with that group there.
Yes, sir.
Chief, so the time that you're asked the contractors to take a break is going to be in morning and the afternoon, both times?
Well, they kind of start around 7:30 in the morning. That's
Okay.
when they start getting there. So they'll be setting up and starting to work then by the time, hopefully, they'll limit the amount of work, because they're just getting there.
And the one-way is only going to be during school hours, correct?
No.
Or it's going to be, is it for the
We're gonna keep it-
120
we're gonna-
days? It's going to be a one-way consistent?
Yes.
All right.
It'd get too confusing if we start doing times and
Understood.
changing this. And
Understood.
now, as the project moves, if we can change some of that, then we'll change it. But I don't
I
want
think
to
this
confuse
is
anything.
a sound plan. I just needed, I was just curious about the timing
yes.
of it. That's all.
And
Thank
we'll
you.
have the signs up. I know Todd's going to be working with us to make sure all the signs are up, and we're doing everything we can to get the word out so everyone knows.
Appreciate it, Chief.
All right?
Okay, thank you. Okay, right. Comments?
Yeah, you and I were part of the Florida League of Cities, conference. And, I can't say enough about exactly how, if they approached me and I think the other council members as well about doing a video. Have they decided to do that or not do that? To educate the citizens?
We, unless Nikki has heard more, we sent them back who was available and have not heard back from them yet.
Understand?
I did see Jordan at the actual conference, and I spoke to him, and he said that they received that email and they're going to get back with us in the future.
Okay.
Mhm.
And the existing codes that you're referring to, are we going to get notification ahead of time of what we need to address when it comes to code enforcement? Some of the ones that need to be addressed, like you identified already.
Yes, that's, the plan for the next council meeting is to have an agenda memo, specifying which, property codes that we think are problematic, and Chief Lewis will be able to expand upon that at the meeting.
I just wanted to make sure that can we get that information sooner than our Thursday normal agenda, so we have time to study it and see what we need to do or not do?
We'll try. It's actually coming out on Wednesday of next week.
Okay.
We do have a 3-day weekend coming.
I understand. But you're city employees, come on. You put the extra hours in, right? All right. I understand.
Okay, we're moving on, renewal selection of employee insurances for FY '26, fiscal year 25-26. There's a lot over there in that section. And, John, I'm gonna ask you to go ahead and give it just a quick summary, what's the important things. Then we'll go ahead and have a consensus or we'll vote on it.
For those new on the council or watching at home, this agenda item covers multiple employee insurances. The largest and most costly is health insurance, which will take up the bulk of the conversation. This year, for fiscal year 26 proposed budget that the council will be considering adopting in September was initially built on an assumption of a 7.5% increase in health insurance costs to the city. As we were getting close to getting the proposed budget pulled together, we had preliminary information about our renewal quotes coming in much higher than that. So we did some last minute adjustments and put an additional $138,000 in contingency. One note for folks new to the city currently pays 100% for the basic plan for employees and 50% for dependent coverage of the basic plan. The city has 3 plans. The marginal difference of the next 2 step-up plans are paid by the employees. The city examined 5 different options. All of them had around 20 to 30% increases. One had a very low increase for the base plan, but significantly higher cost to the employees of co-pays, co-insurance, out-of-pocket. In my opinion, making it unaffordable for many of our employees to use their health insurance. So our maximum out-of-pocket for the base plan and this mid plan are $2,500, $3,500 maximum out-of-pocket for an individual. This lower cost plan was in the neighborhood of $8,000. We settled upon what I have listed in the agenda memo as option 2 from Florida Blue, which is basically our current plan with a 4th pharmacy level. And I will flip down in a minute to show you the specifics. But part there's a three-headed monster impacting health insurance this year. One seems to be an industry-wide 30 to 50% increase for public sector plans. Another is last year we had many high-cost medical claims by employees, and our prescription usage by employees was very high. There's a handful of prescription drugs that you see advertised on TV that are $1,000 to several $1,000s a month. I'm going to flip down. This is the plan that the three plans we're recommending the council adopt. And the pharmacy plan, if towards the bottom of the page there, historically we've had three levels of prescription costs: $10 generic, $30, and $50. Some of these very expensive drugs that there are alternate medications for are hitting right now at the $30 copay. We're recommending adding a fourth level of 20%. What that means is we're not trying to encourage employees not to get the needed care they have, but to have a conversation with their doctors about prescriptions and options. Because if the doctor writes you a prescription and all you have is a $30 copay, most people don't care what it's costing the insurance company and indirectly costing the city. If someone needs the medication that's on a 20% copay, under this plan, the middle plan is what the majority of employees have. Let's say you have 20% and there's that equates to $400 a month. You're not paying $5,000 a year for your prescription. It goes to your maximum out of pocket. So you would max out your maximum out of pocket for your prescriptions, and then healthcare is free. This is not a significant savings to the renewal, but what we hope is it helps bend the trend line in the future down by encouraging folks to have a conversation with their doctors. This shows the bottom line here, the monthly costs combined to the city and the employees. In layman's term, every employee who has basic coverage, has coverage for themselves, the city will be paying almost $1,000 a month health insurance. There are significant increases. Let me go back up to family coverage. These charts here show the impact to the employees. This first section here is for employee-only coverage. With the exception of the PPO, the top option, the impact is not that bad. There's no impact if you take the basic plan. Where the impact to our employees, unfortunately, falls into is family coverage, and especially for the PPO. The bottom, on the bottom of your screen, the PPO with the top plan for family coverage, spouse and children, has a $300 pay period increase. That is a hefty increase, but if that employee with family coverage chooses to go to the middle option, their costs actually can go down from the current costs. So each employee will be encouraged to pick what's best for themselves. Offsetting our costs is something the council last year adopted, which is a stipend in lieu of health insurance. So folks who have qualified coverage by a family member, say TRICARE for military retirees, instead of us paying $1,000 a month for insurance they really don't use, they can elect to have a $250 a month stipend added to their check. We have 4 employees taking advantage of that, and that is saving us a considerable amount of money. And we hope to hire more spouses of retired military going forward, but we hire the best, so that's a jest. Where the rubber meets the road, Councilmember Romy likes that saying, so I had to get it in there, is we would, if you approve our staff's recommendation as listed, staff will take $130,000 out of contingency and reallocate to the health insurance line items prior to first reading at the next meeting. Therefore, on the health insurance side, staff recommends council renew the 3 Florida Blue plans, paying 100% for employee-only coverage, 50% for dependent portion, and providing a $250 a month opt-out payment at a combined estimated cost of $876,659. If council has any questions, I can address the ballpark budgetary side, and our employee insurance broker, Cindy Kubreski of Coastal, is here with us. She is, in my opinion, and I'm being humble here, the best insurance broker anybody can have. Our employees, whether it's the lowest paid full-time person or myself, can pick up a phone and call her office, and they will troubleshoot claims, anything with their coverage. I've never seen quality customer service year-round from an insurance broker like Cindy provides. So any of our fellow sister cities out there watching us, you really need to switch to Cindy's service next year. So she's here to answer any questions you have at this point.
Where's Cindy at? Okay. You mind coming up and we'll see if we can come up with some questions. And if we quick.
Yeah, I have no questions.
Good evening.
I have no questions.
I have no questions for you.
I understand this is something we're gonna have to deal with, but we're looking at a $4,700 increase for a family annually. We're going from $7,400 to $12,000. It's insane, this type of increase. And I'm looking at the profit of Florida Blue at $32.9 billion last year in 24 alone. And you're telling me that this justifies us having an increase of this much? I'm just dumbfounded. There's nothing I can do about it, but I just want to make sure I get my verbiage out there that I'm just disgusted at it. It just doesn't make sense to me. So I can understand a gradual increase of something as time goes by, no different than the cost of living. But these are hardworking people, for crying out loud. It disgusts me. That's all I got to say.
Cindy, can you enlighten our council here about what the insurance industry has gone through this year to come up with those, expenses?
I've been in the business for.
Is the mic on? I don't know if it's on.
Is it on? Oh, okay. I've been in the business for over 40 years. This is my specialty. The last 2 years of the increases, I can't justify it. I cannot justify it. I have worked with John very hard, and I had Florida Blue give me numbers. They've never given me numbers. I just pulled everything out and questioned everything about it. I agree with you. There's the past 2 years, 50% increases. And talking to another agent, there was 100% rate increase for a group, 75% rate increase. That's absurd.
It's a grocery bill. You're literally taking a grocery bill, a monthly grocery bill out of a family's pocket.
I absolutely agree. Florida Blue, the billions, they're a nonprofit organization.
I see that. So is Kaiser Permanente, still the same thing.
How does it happen?
So what are we looking forward to?
Well,
I want to make a note of this, and I'm sorry for jumping in.
Yep.
I don't blame you. You're our broker. You're looking after our best interest.
Yeah.
Florida Blue, that's who I'm worried about. That's my concerns, and that's who I'm disgusted with, not with you, and I appreciate you taking the blunt of this.
It's all the companies. It's not just Florida Blue, it's United Healthcare, it's Cigna, just received 35% increase from a Cigna. It's industry-wide. And I think talking to legislators, just taking a stand where you can take a stand, any other laws that come out about health insurance, the rates have to come down. The deductible for the Affordable Care Act, that's built into the law. That was passed in 2010. That's a long time ago, but it was built into the law to increase every year, same with out-of-pocket. So that's a mechanism the insurance companies are, they're required to change. Out-of-pockets, one of the plans that we look at is $9,700 $9,700. No, it was $8,700 out-of-pocket. That's just an individual. Families double that. So I agree with you, absolutely. Anything that you can do or say when it comes to health insurance, any other comments, I will take them and I'll run them to everybody. I did have a CEO from one of the insurance carriers come by my office Thursday, and I thought, well, that's a nice visit, but what are you doing to lower the costs? What are you doing as the costs go up? We're the middleman, benefit managers for prescription drugs. What's happening? We have to look at it and try to make a stop, but it is that affordable when you're looking at family coverage, even employee coverage at $1,000 a month. That's absurd. So I absolutely agree. So
if we want to take this on, what do you recommend that we do between this year and next year? So we get in a little bit better situation if we can.
Are these increases comparable to the other options that the other providers, like the percentage, in your opinion, John?
Yes, we looked at multiple Florida Blue. The Cigna quote was similar, but had similar costs to the city and employees, but higher costs for the employees to use. Cindy, can you speak to the company that?
Would you agree?
Yeah,
that
absolutely. The original increase that came out was 51%. So, so they came off 20%, and then they were able to come off another 2% by making some changes. But what they're looking for is a plan design. You guys have a good plan design for your employees, and thank you for that. I think that's important, having benefits that the employees can use. Going forward, they're just looking to push the cost, cost shift, and that cost shift is having employees pay more of your out-of-pocket expenses. So
I think that's our job.
Pharmacy is anything that when you hear about pharmaceuticals, anything that you can say or do against what we're paying and what the insurance companies are paying for pharmaceuticals. So
I think that's our job.
And any other ideas, please call me. I will talk to anyone.
I think that's our job as elected officials to, collectively get together and raise these up to the state level, and then it can go up further as well.
I understand. I agree with that very much so, Adam, and I appreciate you saying that.
And
I'm just when I look at these numbers, and this is family with the option 2 is what I was referring to as far as numbers. So basically, you're forcing these families to take a lesser plan that's affordable for them just so they can have it and not have to cut back on whether they have meat that week or not.
Right.
It just doesn't make sense to me. So, and like I said, I appreciate it. Adam's very much so right. We need to take this up to the state level. And hopefully our legislators are listening.
Absolutely.
And hopefully they'll be able to get us some answers. In the meantime, I appreciate you very much for taking the
thank you.
blunt. I'm not an easy one to get to handle, and I'll let you have it. But
that's
you're
all
not.
right.
You're taking the blunt for Florida Blue, nonprofit or not. They disgust me. So
Okay,
I appreciate it.
need-
Thank you.
Okay, we
Thank
need
you.
to move on.
Yeah.
Cindy,
Excellent.
thank you.
Thank you very much for
Yes,
your
Thank you,
time.
ma'am.
Thank you.
We need to look on the package that's presented now. And this would be in the form of a motion.
So do you have a proposal for table for other options, or you would bring it up for a motion? Or?
I've already talked to John a little bit, knowing that, and we've already educated us. John walked us through it. This is our best option.
I agree.
And they can't do without. So.
I agree.
I'm here.
So I'd like to make a motion to consider approving the lines of recommended employee insurance for FY '26 with a combined estimated cost of $876,659.
Second.
Okay, we have a first and a second. All in favor?
Aye.
Aye.
The next ones are much easier to deal with.
Well,
Dental insurance, the city in fiscal year '23 switched to Delta Dental and their deluxe 300 PPO plan, paying 100% employee premiums and 75% of dependent premiums. The proposed budget includes $41,000 and change for this. Delta Dental gave us a 0% increase. Most employees are satisfied with the coverage. Staff did not seek alternate quotes. Therefore, staff recommends the city council renew dental insurance coverage through Delta Dental for their deluxe 300 PPO plan and continue to pay 100% for employee-only coverage, 75% dental coverage at an estimated cost of $41,480.
any comments?
No.
Do we have a motion?
I make a motion to renew the dental insurance coverage through Delta Dental for their deluxe 300 PPO plan and continue to pay 100% for employee-only coverage and 75% of dependent coverage at an estimated cost of $41,480.
Second.
Okay, we have first Susan and second Adam. All in favor?
Aye.
4-0.
Next one is vision. In fiscal year '24, the city switched to Delta Vision Deluxe plan. Proposed budget includes $9,033. Delta Vision also provided a zero increase renewal. Employees who elect this coverage are largely happy with it. We did not request a second quote. Therefore, staff recommends City Council renew vision insurance coverage through Delta Vision for their deluxe plan and continue to pay 100% for employee-only coverage and 50% for dependent coverage, an estimated cost of $9,033.
I'd like to make a motion for renewing the vision insurance coverage through Delta Vision for the deluxe plan and continue to pay the 100% for employees only coverage and 50% for dependent coverage at the estimated cost of $9,033.
We didn't have any comments, right?
No.
Okay.
Second.
Second? All in favor?
Aye.
4-0.
And the last item, the city participates in a flexible spending account that allows employees to take pre-tax money out for eligible expenses. IRS announced the new limit is $3,300. Staff recommends that City Council approve the increase of the optional FSA maximum to $3,300 a year.
Motion,
There's no comments. I'd like to make a motion to approve the increase of the optional FSA maximum to $3,300.
Second.
okay, we have, all in favor?
Aye.
Aye. Okay, we have a first with, and a second with Susan.
And the last is just a note that employee life insurance lines are provided through our liability workers' comp insurance provider. We anticipate these being on one of the next two council meetings for approval. That concludes this agenda item.
Okay. We're moving on to, let's see, we got signatures, don't we? Somewhere. Yes, we're moving on to, resolution number 764, updating the banking signatures.
With the sad news of City Clerk Frank's pending retirement, the city needs to update signature authority with our bank, Truist Bank. The attached, quote, resolution allows that. Of note, and thank you for City Attorney Bone pointing it out, the resolution is not a typical city resolution in that it doesn't have a title. The resolution actually is the two attachments that Truist sends us. So if you can imagine a header being on top of the attachments that say resolution number 764, we will add them after the meeting if you approve this agenda item.
Okay.
Council recommends approval.
We have a motion.
Recommends.
I make a motion to approve resolution number 764, authorizing certain city officials as signers on the city's banking institution accounts for the city of Indian Harbor Beach.
Second. Second.
Second.
Adam? Okay, we have, all in favor?
Aye.
Got it. Okay, we have a first and a second, and we're kind of taking care of business.
Yes, sir. Yes, sir.
Especially the big boy.
Mr. Deputy Mayor, you have public forum.
Public
Okay.
comments?
Public forum. You know what? There's nobody here. Okay. We have a public forum. Does anybody want to come up and speak at non-agenda items? Anything, you got 3 minutes. They're hiding. Okay.
I'd like to make a motion to adjourn if there's no public comments.
Second?
Second.
Okay. First and the second, we're all gone.
Aye.
Yeah, aye.
You know what? You gotta cut down your time.